Thank you, Matthew. Good morning, supervisors. Good morning, community. Thanks for this opportunity to share the COVID-19 update for today. Alvaro, if I can have my slides, please. I'll start with an update on our numbers and then get into some of the key strategies for this week. Next slide, please. So these are numbers taken from our website, which is updated daily. Almost 12,000 now total cases in Marin County, with 84 currently active cases countywide, 180 deaths, almost 450,000 tests now completed since the start of the pandemic, with about 170,000 residents now have been vaccinated with at least one dose. Next slide, please. And this is a blow up of our epidemic curve. This is when we talk about flattening the curve. This is what we've been sharing every day. And this shows a gradual decline in cases since that peak in mid-January. We're seeing progress over each week, now leading us into the yellow tier again. And I'll talk more about that in a minute. Next, please. And this is that same epidemic curve, but over the entire experience of the pandemic from our first cases in early March, showing that we are now at a case rate per 100,000 residents that matches the case rate. The last time we had case rates at this level was just about 1 year ago in early May. Next slide, please. And this is our hospitalization and ICU census, where there are 4 Marin County residents, or our hospitals in Marin County have 4 COVID-19 patients currently, with 2 in the ICU. Next slide, please. So this, as you know, we are functioning within the California blueprint for a safer economy with the colored tiers. We are in the 3rd tier, the orange tier. We had accumulated 1 week towards yellow 2 weeks ago and then backslid just a bit. And so we were back reclassified, or continue to be classified, in the orange tier. Now we are back again with another week under our belt in the yellow tier. Our case counts at the week ending on April 17th were 1.5 cases per 100,000 residents per day. We need to be beneath 2 for 2 consecutive weeks. And our numbers for this week that ends on April 24th, and that's the week that the state will look at on next Monday to determine whether we would move forward. Those case rates are appearing lower currently. So it looks promising, again, for us to have accumulated that 2 weeks to move into the yellow tier. And that move, if in fact we are able to move forward, would happen at the earliest on May 4th. Next slide, please. And this just shows by comparison our case rates compared to other California counties, and serves as a reminder that with the progress we've made, we are still in a state and an environment where COVID-19 transmission is still occurring much more widespread around us. Next, please. Now getting into our vaccination progress. This is our daily dashboard for vaccinations in Marin County. 81.1% of our population that are eligible to be vaccinated, that is residents age 16 and above, have had at least 1 dose, and 58.7% have had 2 doses. That puts us as being among the most highly vaccinated counties in the state. Next slide, please. But it's important to recognize that with all of that progress, we still remain vulnerable. And I've broken that down here with our total population. This is the census estimate. So the total population, you might notice in different ways. Sometimes it might be measured differently. This is 255,000. You also see 260,000 for the Department of Finance. So this is the estimate from the census. We have, among those who are eligible to be vaccinated, age 16 and above, there are 209,000 residents. That's about 82% of our population. And then those that have been vaccinated with at least 1 dose is about 66.5% of our population. But those that have had 2 doses and then had that 2 weeks or with the one dose regimen 2 weeks after that, who are actually now presumed to be fully immune through vaccination, is only 39.1%. So about 6 out of 10 Marin County residents remain susceptible to COVID-19 infection, despite the progress we've made in vaccinations. And then that bottom there, the 15.6%, that's really the focus of the next few weeks in our vaccine distribution plan. Those are those who remain eligible. They're 16 and above, but have not yet been vaccinated, about 40,000 residents. Next, please. And this also compares how Marin County fares regarding vaccination rates compared to other counties across the state, and shows that we have the highest vaccination rates. Next slide, please. And then breaking that down by age group, among our residents aged 16 to 49, 28% remain unvaccinated. Among residents aged 50 to 64, 19% remain unvaccinated. And among residents aged 65 and above, only 4% remain unvaccinated. And that's a reflection, that last number is a reflection of our progress regarding it and our focus on our older residents early in our vaccination campaign, really sticking on the age 75 plus and then age 65 plus, recognizing the much higher risk for hospitalization and death in that age group. This is our vaccine progress by race, ethnicity, and shows as we continue to move forward that we have been working to try and have our vaccine distribution plan match the disproportionality of the burden of COVID-19 across racial groups in Marin County. Our Latinx residents, make up 16% of our population, but made up a full 54% of cases of COVID-19 in Marin County. And so we've been focusing as much as we can on making sure that there's equitable access and removing any barriers to vaccine for all groups in Marin. Next slide, please. So we're at a pivoting point here in our vaccine distribution plan and are shifting our strategy. And I've divided this into 2 phases for our understanding. Phase 1 was December, from the first doses arrived in mid-December through just about now, mid to late April, characterized by a demand for vaccine that exceeded our supply. Our distribution plan was really mainly focused on mass vaccination sites. The majority of those, 150,000 or so Marin County residents that have been vaccinated in one of our mass vaccination sites. It has been more of a centralized process, focusing on efficiency, focusing on equity, with gatekeeping by age criteria, by occupation, by community, and really ensuring that we're reaching those that are most vulnerable first, given the limited supply. We're now entering another phase of our vaccine distribution. We'll call it phase 2, and that's going to be May through July. It may extend beyond July, but I think this is a reasonable estimate for now, where it's characterized by supply that exceeds demand. We are for the first time seeing hundreds, if not thousands, of unfilled appointments over the next week in Marin County, and that's true across the Bay Area. So as we move into phase 2, vaccine distribution is going to be more diversified and less centralized into healthcare providers, primary care clinics. Our hospitals will be providing vaccines. We'll be doing more mobile operations, so shifting public health vaccine operations into the mobile setting with 8 different mobile teams traveling around the community to offer convenience-based vaccine operations. And the pharmacies are also offering vaccines the way we do with flu vaccine. It is open to all, so it is no longer, we're no longer gatekeeping, or there is no longer any exclusion criteria for vaccine outside of age. Right now, age 16 and above are approved. We may be moving to 12 to 15-year-olds. We're eager to see that announcement from the CDC and the FDA, which may be forthcoming in the next couple of weeks. We're able to expand the age criteria, but anyone who's eligible by age is now able to walk up to any of our vaccine operations and receive a vaccine. So it's really, that phase is going to be characterized by convenience, trying to meet people where they are, and instilling more confidence in the vaccine and its safety and efficacy among those who remain hesitant. Next slide, please. So this is for our community to know where and when you can get your vaccine. This is this week, and we'll continue to offer this information on our website. And these are sites where now anyone can simply walk up to obtain a vaccine. We prefer someone schedule an appointment, and all these also have appointments where you can actually register online at getvaccinatedmarin.org. That's our website. But you could also just go to these sites and present yourself and receive a vaccine. Right now, we're still using the Pfizer and Moderna vaccine. Next week, we hope to be starting to offer the Johnson & Johnson vaccine again, once we have the materials from the state of California that allow us to have the informed conversations we want to have with our community members as they navigate choices around which product to choose. So these are, again, these are the sites that are available for the remainder of this week and reflects our shifting from our large-scale mass vaccination operations into more diverse community-based operations. Next slide, please. So removing any barriers to vaccine, are appointments needed? Appointments are encouraged but not required, and walk-ins are welcome. How fast is the process? It takes about 20 to 30 minutes. They're moving quickly now. 15 of those 20 to 30 minutes are the required observation time after someone receives a vaccine to make sure that they're doing okay before they're able to go. So it should be convenient within the context of your life. And then what do you need to bring? For the first dose, you need a photo ID. That's all we need is a photo ID. And for the second dose, we would need the photo ID and then the vaccination card to make sure that the timing corresponds to when the first dose occurred. If someone is having trouble finding an appointment for their second dose or did receive the first dose but doesn't know when that second dose is, obviously we do everything we can on site to make sure that that second dose appointment is well established and people know where and when to come. But there may be occasions where that may not be the case. Anyone who's waiting for their second dose, just come to any of the sites that I just outlined. Bring your photo ID, and we'll make sure that you either get vaccinated right there and then, or find an alternative if they're not offering the product you need for your second dose. Next slide, please. So our COVID-19 toolkit has now expanded to include vaccinations, which I've circled there. So we're still covering our nose and mouth with a mask. That still remains an important strategy for us, especially indoors. With only 40% of our population fully immune through vaccination, the majority of us remain vulnerable. So those non-pharmaceutical interventions remain critical for us as a community. Maintaining 6 feet distance from people that you don't live with, who are not part of your household, avoiding crowds in poorly ventilated spaces, frequent hand washing. Vaccine, I think right now is probably our single most important line of defense. And we've made a lot of progress there, but there's about 15% of our population who are eligible who remain unvaccinated. And then seeking testing, especially if people are having symptoms. And we still have testing operations. There are many unfilled appointments also in our testing operations. So there should be no wait for anyone who's seeking testing. Next slide, please. So I've already mentioned why we're still vulnerable in terms of just the fact that the majority of us are not yet fully immune through vaccination. Next slide, please. So what can still go wrong? Mask fatigue and breakdown of non-pharmaceutical interventions. As case counts decline, as we have higher vaccination rates, as we move forward into the tiers, likely moving into the yellow tier, there's obviously a concern that people would misinterpret this as a sign that the coast is clear and that we could let down our guard. Unfortunately, that would lead to backsliding, that would lead to increased cases, increased hospitalizations, in fact, increased deaths. And so we need to make sure that we are not letting down our guard here, and we have to make sure that all of us recognize the ongoing need for the next few weeks and months for the things we've done all the way along the way to flatten the curve in Marin County. Unvaccinated groups can sustain transmission, and that's one of the reasons why we are so eager to make sure that we're removing any barriers to vaccine in the mobile setting, getting out to every community and every group to increase vaccination rates. When vaccines, when people who are unvaccinated are also alike in terms of where they gather, whether it's at the school level or other community groups, that's a risk for all of us because the risk of an outbreak within that group is enhanced if a group of people who socially gather are collectively under-vaccinated. Those are pockets within our community of vulnerability. So we want to make sure that we're addressing those. There's obviously a concern of waning immunity from vaccine. It's looking good from the trials that people who were vaccinated 8 months ago in those trials or even further out, their immune systems are still strongly protected, but that potentially would start to wane and we would need to offer booster shots when that happens. And then the emergence of more transmissible or less immunologically susceptible variants is obviously a concern. If we look across at what's happening in India and other parts of the world where there are so many cases where the likelihood of mutations that would arrive that might confer that resistance to the vaccines increases with time, and we need to be monitoring that from a global perspective and may need a local response for boosters if that occurs. So it's critical from a national perspective that we not ignore the international nature of this pandemic and that we pay attention to international needs. Next, please. And then just a reminder of our school situation. This has been one of our priorities all the way along, making sure that our children are able to be back into classroom-based learning. Right now, the vast majority of Marin County schools are full-time, in-person, 5 days a week, and that's been one of the really critical strategies for us and points of progress for us as a county. This shows that almost 2 million student days have now accumulated in Marin County. But that is, 1 day of being a child in school in person for 1 day. With 2 million of those, we still have only 12 cases of established school-based transmission and no cases where a child has infected an adult in that setting. Next, please. So in summary, COVID-19 transmission continues to decline slowly in Marin County. Safely reopening will rely upon high vaccination rates and continuous adherence to and vigilance around our non-pharmaceutical measures. We are now in an open season for vaccinations across the county. Most of our schools are now fully reopened. There are many unknowns regarding our pandemic path and will continue to need to be tightly connected and following the science and adapting our strategies as we go. But the light at the end of the tunnel is getting brighter. Thank you. That concludes my presentation.